It's 10:01, and I know we're still expecting more participants, but we'll go ahead and get started, and we'll leave the poll up so as people come in, you can take the poll. Want to welcome you to this part one of two parts on hazardous pharmaceutical waste. Today, we're going to be addressing the employee safe handling part of this, and then next Wednesday at 10 a.m., we're going to talk about the waste disposal requirements. And it's an interesting thing because we learned from a couple of our members not too long ago that they had been visited by Cal OSHA inspectors and or local inspectors that were representing the Department of Toxic Substances and Control. So there are the two aspects of this. And even though this is not really a new thing, and I don't know what the poll is going to show yet, but I have a feeling that many of you are not currently aware of these requirements. And I think very few of us in the assisted living space were aware of them prior to this. But what we're going to do today is help you to understand what these requirements are and get prepared for them so you can be in compliance. I'm Selena Copey-Hornback, CALA's Director of Public Policy. We're going to go through all of these things today, hoping to reserve about 5 to 10 minutes at the end to answer your questions. So please feel free to add them to the Q&A box throughout this webinar. We'll get to as many of them as we can. If we can't answer them all, we'll capture them and then we'll find a way to get those responses out to you. I'm going to introduce our speakers now. We have with us Jeff Herr, who received his Doctor of Pharmacy degree from the University of the Pacific Stockton School of Pharmacy. In January 2011, Jeff entered the field of long-term care pharmacy, working as a manager of clinical operations for PharMerica, now covering California and Hawaii. Jeff works with state and federal entities regarding clinical and operational regulations, as well as working with clients big and small, developing clinical systems to help long-term care facilities give the best pharmacological health services possible. Diane O'Malley is a partner with Hanson Bridget LLP. Her practice specifically focuses on representing senior living provider employers. Diane has expertise in traditional labor law covering union negotiations, grievance and interest arbitrations, and unfair labor practice claims. She also provides counsel on discrimination, harassment, retaliation, contract, and wage and hour claims. Diane is a graduate of St. John's University School of Law. Glenn Thomas is the Director of Safety and Risk Management for Continuing Life. He oversees all safety, security, risk management, and disaster response operations. Glenn began his career in public safety in 1997 as an emergency medical technician and continued his career with CAL FIRE and San Diego Fire and Rescue as a firefighter EMT, serving the citizens of San Diego County. Glenn has served on various emergency response and disaster response and mitigation task forces and operations. Maddie, if you could go ahead and close the poll and show us the results, that'd be good to know before we move on. Okay, so actually more people than I expected are already following this plan for their employer safe handling. And we have a mix of attendees, so this is great. Okay, you can go ahead and close that. So today we're going to help you define and identify the medications that are considered hazardous waste. If you have them in your community, maybe you don't, but it sounds like there are a few that you probably do have. We're going to go over the various employer safe handling requirements, and then we'll finish up with some compliance and best practices. And I will go ahead and turn it over to Glenn to get us started.
Good morning, everybody. Thank you so much for the opportunity to present to the group. As Selena mentioned, today we're going to be doing a general overview of the pharmaceutical waste requirements, and then in part two we'll dive a little deeper. We'll get into more of the weeds a little bit more regarding real-world examples, and then also actual waste disposal requirements and techniques. So we're going to start with talking about just the general importance of this. And some of you may know, or you may have heard recently, there was a large provider in the hospital world that is dealing with some challenges with pharmaceutical waste and general waste disposal issues. Ironically enough, today, after I'm done with this webinar, immediately after, I'm going to be assisting one of our communities on site with an inspection from Ventura County. And it just so happened that they wanted to show up today. So it is timely. It is a real world thing that's going on, and we're going to make sure that we can be prepared. So, what is the Pharmaceutical Waste Act? The Act specifically identifies RCFEs as a business that generates waste. Accordingly, RCFEs must comply with the Act's requirements. These include, among other things, the registration, storage, and disposal requirements. And next week, we'll dig a little bit deeper into the registration requirements. Today, we're going to really talk about kind of the storage and disposal a little bit more. Who regulates this requirement? This is where it gets a little complicated. We have multiple regulatory agencies that have their hand in this, and that's the EPA, OSHA, DOT, or Department of Transportation, and then DSS and CDPH as well. They also have a level of enforcement, and that level of enforcement varies depending on the county of operation that you're doing business in. So, what constitutes pharmaceutical waste? And I think this is what really gets a lot of providers caught up: is where do I put waste? What constitutes what? What goes in which bin? Is it biohazard? Is it a sharps? Is it actual pharmaceutical waste? And really, we have to clarify as to not mix up a lot of these things when we're talking about this requirement. So, pharmaceutical waste itself, by definition, prescription or over-the-counter drugs. And obviously, if a drug's expired or it just needs to be discarded, as a med tech or someone in your facility is popping pills and it hits the ground and we have to discard it, we need to be able to identify that prescription or over-the-counter drug to dispose of it properly and decide which type of receptacle or container it goes in. So when it makes it through down the line to be disposed of, it is being disposed of properly. And the reason for this is just because obviously these things can be harmful to the environment, and we have to take that into consideration with groundwater and landfills. It also can be harmful to people, our employees, so we want to protect them. So these drugs can be generated through IV preparation, compounding of pills, spills, breakage, partially used vials or syringes in IVs, keeping in mind that we have to deal with partially used, again, syringes, IVs, vials, differently. We can't just discard it into the general receptacle or sharps container if there are, in fact, still residual trace amounts of the drug or narcotic in that vial or in that IV bag. And then pharmaceutical agents, whether they're in solid form, liquid form, gas form, that can pose a substantial hazard to human health in the environment when not properly managed, are deemed to be hazardous. As we progress through this presentation, we're going to dig a little bit deeper, actually a lot deeper, into the different types of pharmaceutical waste devices, whether it's maybe a typical white bin with the blue lid that you see, or a black bin for more acutely toxic drugs, or a general sharps container. We'll dive deeper into that, and then we'll also dive a little bit deeper into how we identify those drugs, what some of those common drugs are that are going to go into those different receptacles. So we're making sure to create as safe of an environment as possible when dealing with this topic. So this pictorial is nice from a training perspective for staff. It provides a means for staff to easily identify kind of what the hazard is associated with these drugs. When you talk in the OSHA world, some people may have heard of the globally harmonized system, and it's just a system to where even if you have trouble reading or understanding the English language, you have pictograms that you can look at to be able to identify, Are they ignitable? Is that what the issue is with the drug? Is it flammable or ignitable? Is it corrosive? Is that drug corrosive to human skin or the body in general? Is it reactive? Does it react to other drugs, or does it react to more common things, maybe like water or other liquids commonly found? And then, is it toxic? And then, how the level of toxicity that drug may pose. So we brought this slide in to show that there's, from a staff training perspective, there are great tools out there to be able to help identify how a drug may be hazardous to somebody, and to be able just to easily identify it, whether it's on a pill bottle, whether it's on an IV bag, or on some other type of device as well. And at this point, I'll pass it over to Jeff.
Thank you, Glenn. And it's good to be here as well. And thank you all for attending this. As Glenn was talking, he's talking about the EPA waste, and there's a new item coming. It's USP 800. And the EPA guidelines are more about how to discard it, and the USP 800 is more about how to handle it. So right now it's informational, but as of November 1st, 2023, it is going to be compendial, which means that, as Glenn pointed out before, somebody from one of those governmental entities can come in and survey your facility to see if your staff is handling these type of medications properly. And it affects all healthcare settings. So anybody who receives it, prepares it, administers it, transports it, or otherwise comes in contact with it, those are all involved. It uses the NIOSH hazardous drug list, which you could find just by Googling NIOSH hazardous drug list. It was last updated in 2016. Again, it's going to be updated in 2023. Right now, there's 3 sets of different drugs, and they're going to narrow it down to 2. Currently about 200 medications. And again, not the same as the EPA. So looking at that sample of knowledge in the beginning, maybe most of you haven't heard about this because it's been a long time in the coming. There are some F tags that the skilled nursing facilities will be hit with, and probably some W tags in the assisted living world that, if it's not handled properly, you can get tags on that as well.
Jeff, you're muted.
The following are different types of pharmaceutical waste that you're probably going to be dealing with. Non-hazardous, most of the drugs. Then you have your hazardous drugs, which are on the NIOSH list and the EPA's hazardous waste list. The EPA's is where you hear about the things like P listed, U listed, and those are those type of drugs that are ignitable or toxic or flammable, that kind of thing. NIOSH list is what can be toxic to everybody touching this medication or handling it. And so that's really the difference here, is the handling and the disposal. The P-listed hazardous waste, controlled substances, U-listed hazardous waste. And that's the bulk chemotherapy that probably most of you won't be dealing with. But just to keep in mind, there's a lot of different avenues you can go with this hazardous waste, and you need to be aware of it because it's very important to keep your staff safe. And with that, I will give it over to Diane.
You're muted, Diane.
Sorry, didn't know I had to separately do that. Good morning, everyone. I'm happy to be part of this panel. Obviously, I'm more focused on the employee side of things in terms of safety. This actually does come into play a lot. Mostly what we'll be talking about is, if you look at there, some of your employees are going to be handling or manipulating some of these hazardous pharmaceuticals. You already have in the health and safety code an obligation to be training your your employees on a whole host of things, and these come into play as well. You know, Jeff and Glenn are talking about some of the rules that are in place to protect them, but I just thought I'd go through a little of just the general employer obligations you have to be careful about, and where, you know, of course, I'm always going to wind up talking about possible lawsuits, where if you don't follow what Jeff and Glenn have been saying, there is a possibility you could get into some pretty expensive, not only, you know, we're always talking about Cal OSHA citations in this world, but also remember there are other civil lawsuits that could come in play as a result of these violations. So on the next slide, I, you know, give you, first of all, for those of you who have, you know, communities outside of California, as you know, there's the Fed OSHA, and then there's Cal OSHA. Cal OSHA is the governing board unless there's something on the federal level that overrides it. So for those of you who are both in and out of California, you're looking at really both. And what we have is what's called a general duty clause, which is always being cited, certainly in citations, which say, look, at the end of the day, regardless of what we're talking about, you're required as an employer to provide your employees with the term is employment and a place of employment which is free from recognized hazards. The, you know, the obvious important word there is recognized, but still it's your recognized hazards, some of which are what we're talking about today, obviously, that are causing or are likely to cause death or serious physical harm to employees. And so that's kind of all those key issues there are, what is it that you are aware of that you know is out there? And that's kind of what we're talking about today. The next slide shows that, you know, California, Cal OSHA has the same what they call a general duty clause, but for purposes of my world, what's interesting, or I should almost say unfortunate, about California's general duty clause is that it is in the labor code. It's not in Title 22, it's in the labor code. And of course, for those of you who may know, that once it's in the labor code, this could be a possible violation that results in Private Attorney General's Act or PAGA penalties, because employees can bring lawsuits based upon a violation of the labor code for penalties. And so again, this is a very generic, you're required to provide and furnish an employment that is safe and helpful for your employees. So that is just encompasses a host of things. And, you know, I do want to add that in this specific area that we're talking about today, Labor Code Section 144.8 actually does talk about how to handle these type of hazardous pharmaceuticals. Well, not how to handle it, but it recognizes this is a specific area, and it references back that and this goes back to 2014, where the legislature was all of a sudden back then starting to realize, hey, this is an issue we need to address in terms of in the healthcare industry, in terms of employees handling these type of drugs. And so therefore we and basically what this labor code section just does state is they will follow, for the most part, the NIOSH guidelines that both Jeff and Glenn had been referring to earlier. So what's interesting on the next slide, you'll see that is only makes it more difficult for you as employers is that, again, it's in the labor code. So this could be a violation seeking PAGA penalties, that your employees do have a right in the labor code to refuse hazardous work. It is illegal for employers to punish employees. For example, if you consider it insubordination and you terminate them, you give them some sort of discipline. So it's illegal for employers to punish employees for refusing to perform hazardous work. If both of these things are true, first, it would violate a health or safety regulation. That's kind of the easy one. If you're supposed to be doing something perhaps like Glenn was talking about with respect to which bins do you put certain waste, and you're not doing that, and that would be a violation. And but the second one is the violation would create a real and apparent hazard to the employee or their workers. And that's when it gets a little bit in the gray area. But I would suggest that if you're violating the regulation, Cal OSHA is going to find, well, if you violated it, you've created a hazard. So this is something that I think you need to specifically train your employees at the level that are supervising employees who are actually dealing with these hazards, because they may not know, and they may just have, and like they do in many areas, like just kind of a reaction to, no, you have to do this. This is part of your job. There should at least be, let's stop and talk about this. If the employee is really refusing to do this, what this means before we move forward, so that you don't wind up with a violation of the labor code. We did have, for example, as I'm sure you probably all did during the initial COVID pandemic, when there were employees who refused to come to work, refused to work with maybe residents who had tested positive. This is similar to those type of pretty difficult issues in terms of employee relations. So the next slide, which I think is part of it, and this is, I don't know if Jeff wants to add anything to this, but this is just, you know, in terms of whether or not the employee is reasonably refusing to do work. Here's a document that where the employee acknowledges that they have been trained and that they have, you know, and you know, what has been given to them and explained to them with respect to the risk of, you know, working with certain hazardous materials, how you work with them, how to keep yourself safe and others. So, you know, it's always a good idea when you have these type of things. It's nice to have a document that says, hey, here, you know, you've been trained on this. We've given you examples of what you should and should not be using. And Jeff, I don't know if you want to add anything with respect to the use of this document.
Yeah, I think the point is here, and you made it earlier, this has a place in the document that shows that the facility has put in place a variety of administrative, engineering, and work practice controls to reduce that risk. And that's really important that they know that, you know, what to do and how to make their work environment safe.
Right, because, you know, I mean, what we're talking about here, you know, part of the hazards that maybe some employees certainly are considering, and I know we came up with this a lot. Again, I'll refer back to the COVID pandemic. There may be employees who realistically are concerned because they're pregnant or that they want to be pregnant. And there are, you know, these drugs do have their, you know, or studies that have shown that there are possible harmful effects on reproductive organs, people who are immune compromised. Perhaps in some circumstances they can cause cancer, which is why you have all of these safeguards around them. So some of these employees' concerns are not unfounded, but your job is, of course, to demonstrate to them these are all the safety precautions we have taken in place to assure that these risks are, if not totally removed, they are certainly minimized to the level that we believe it is safe for you to work in this environment.
And Diane, just to make mention too, to go along with what you're saying, most of these drugs are found toxic when they're ingested, when there's larger exposures. When you're talking about your staff in the facility, nurse or med tech that's passing medications, they've got gloves on, they're poking it through, you know, the drug card, it's going into a cup. They're not touching this medication at all. So the exposure is extremely minimal. And that's really important to let them know about that as well, so that they feel safe in what's going on now that they're all of a sudden finding out all these drugs, you know, might be hazardous.
Right, right. Yeah. And that's the other thing. I mean, I think, you know, and again, correct me if I'm wrong, you know, some of the things, and again, first of all, it's not all of your employees in any event. It's just, you know, a small group, but nonetheless, to the extent they may have to be in the job portion of either destroying these, resident has died, they're no longer, you know, there are certain protocols in place for that. When they're setting up, maybe some of these medications perhaps have to be either poured, or, you know, there's also, for whatever reason, they happen to come in, you know, not in the normal course, but they do for some reason come in contact with them. There might be something on a counter that hasn't been sufficiently washed. I think there are some emergency injectable medications sometimes that happen that may, whatever it is, what we're trying to do here is just make sure that, you know, stuff like that doesn't happen. And this is a very low risk, but nonetheless, it's a risk that apparently, based upon what the anecdotal evidence that we've heard, that Cal OSHA is now apparently starting to come into some members' workplaces and ask about these. So that's one of the reasons why we're having this. But you know, and just to make matters, I know you have a gazillion things you have to think about on a day-to-day basis, but just as an aside, making sure that everybody knows that just recently, DSS has adopted a number of changes to the general infection control regulations, and they're more kind of clarifications, but nonetheless, it's something. I think there's a recent pin that was put out about it that you could look, or just generally look up those. And I think on the next slide, I might put just some of the things that you do just need to be careful about. Again, the type of hand hygiene, it's, hand washing with soap or water or sanitizers. They have some changes with respect to disinfection. They note that it shall occur when surfaces are contaminated. Some of this stuff one would think, you're already doing. And then they talk about enhanced cleanings when there's a contagious disease. I don't know if this was as a further refinement that what happened as a result of COVID, but nonetheless, they've put it out. So it's something that you should be looking at. And I don't know if there are any others in the, yeah. And then just generally, they talk about the needles and the syringes. Of course, as we all know, you have to exercise extreme caution when you're handling those type of things. Replace it in the sheath or the guard, how you have to remove it, and placing it in a puncture resistant container. All of these things, it's just a reminder and an enhancement that they talk about in the new regulations that they've, well, not new, but the amended regulations that they put out. So I think, and here, again, I don't know, maybe Jeff, if you want to address this a bit, this is some of the hazardous medications that I know Glenn touched about it a bit, but if either of you want to just add anything, is kind of, this is what we're talking about to the extent people need any additional information.
Diane, we'll be in the next couple of slides also, we're going to elaborate quite a bit on the U listed and P listed and different examples of some common medications that may be found.
Yeah, and if you notice there, I kind of talked about some of them, they do have, it's been known they do have serious side effects. We talked about it, fertility problems, genetic damage, birth defects, cancer, things like that. And those are all things, again, obviously, if employees are hearing about that, they do have concerns, and you want to make sure that you at least address those concerns to make sure that they understand that it's as Jeff pointed out, it's pretty minimal. But and also, I guess, these are hazardous drug categories. I think Jeff or Glenn, you want to
Sure.
Jeff.
elaborate?
All right. So table 1, these now are drugs in the NIOSH list. Table 1 are the anti-neoplastic drugs. Neoplastics are the drugs that, or anti-neoplastics, they go after the inhibition of uncontrolled growth of cells, cancer, right? So these drugs can also do the same thing to your normal cells. And that's why this is in a table 1, probably the most restrictive element, as you'll see in a minute, because there's nothing you can do other than follow the guidelines on this table 1. Table 2, the non-anti-neoplastics, they are in the but 1+ NIOSH criteria. And the criteria is pretty huge. It's anything that they find that affects humans or animals in carcinogenicity, I can't speak, developmental toxicity, reproductive toxicity, organ toxicity, the list goes on. So that's a table 2. And then table 3 are primarily drugs that poison the reproductive risk. And that's why in the future, they're going to combine table 2 and 3 because they're all toxic. And basically that is the take home for those particular drugs. And show the next slide there. This is the how-to. So I know all of you have been going, oh, wow, there's all these toxic drugs. What do we do? How do we handle it? And NIOSH puts out in the NIOSH list this table 5. And this is going to be very important for your facilities to get a copy of this table 5, because this explains everything that your staff has to do. And just the way it works is they have the formulation on the left. And let's just take a look at the third one down, tablets or capsules. And they look at the activity, whether it's administration from unidose package, that's the intact tablet, or cutting, crushing, manipulating, which is everything you guys do. And then as you go across the list, It gives at the top double chemotherapy gloves, protective gown, eye face protection, respiratory protection, ventilated engineering. And it tells you yes or no or what you need to do in these areas. And so the reason that's important is because, one, it gives you clear guidance on what your staff should be wearing in terms of PPE. But go to the next slide. And this is an important part of this too. This is a hazardous drug assessment of risk. Now, again, I said in table 1, you have to follow the guidelines specifically to what they are. But in the table 2 and 3 drugs, your facility can come together and decide, well, you know, because our med tech is poking this out, never touching it, it's going into a cup, being handed to the resident. We feel that the risk of this particular drug is minimal. So you can fill out one of these forms where it has the drug name and the dosage form, a few other questions about it, and then you can see the rationale for alternative containment strategies. And the rationale might be, instead of using 2 chemo gloves, our nurse is going to wear just a standard nursing glove to handle this, because the rationale would be this drug is never going to be touched. So the mitigation of risk is there. These you want to keep on file for up to 5 years. And it's a way to get around the constraints that the USP 800 can put on your facilities. Because we all know that the cost of these PPE are very high. And if you're giving a lot of this type of medication and you're using a lot of PPE, it can definitely, increase the cost that your facility is going through. So please keep in mind this assessment of risk form, and your pharmacist who comes into the facility can definitely help you guys formulate these forms to make sure you have everything on there that you need to protect your facility. All right. Glenn, did you want to go into this one?
I think this is Diane's slide.
Yeah, this is just, again, this goes again with your training of your employees in some areas where they may have some exposure to something that would result in them being at risk for some of those effects that we talked, the harmful effects that we talked about earlier. So again, these are just some of the suggestions, well, more than suggestions that we have with respect to that in terms of any employees talking into what Jeff, or going back to what Jeff was talking about, is the PPE, that you make sure that any employees that may be near or have a result in being exposed to urine, feces, that they are wearing their PPE, and that absolutely everything is discarded after all use. Same thing with the hand washing, wash hands with hands and soap, removing gloves. Whenever they have been in contact with any of those type of substances, and of course the contaminated linens due to exposure, they should be placed specially marked laundry bags and then placed in labeled and in an impervious bag, because again, you don't want one of your housekeepers just without gloves picking them up and throwing them into the general laundry bin. So these are all type of things that you have to be looking at, again, that will show both to Cal OSHA that you have sufficient safeguards in place so that you are not creating a hazardous work environment, whether it's in violation of any specific regulations, as well as just the general duty clause. Because remember, even if it's not specifically something that is specifically a violation of some specific, they may already go back to the general duty clause and say, well, nonetheless, the employee believed that this was, and then you're battling in court over whether or not this was actually an unsafe environment. So the more that you can do is usually, in this particular instance, the better. And and again, this all goes back to remember, because I know in every single citation instance that I've been involved in, especially in of late with respect to all that was going on in terms of the pandemic, one of the first things that the inspector always asks for when they enter the building is your injury and illness prevention plan. And, you know, obviously that's something that you have to have in place. And also that employees have a specific right to review when they request it. So it's very important that all of these things are specifically included in your injury and illness prevention program in terms of identifying the hazards, identifying your training programs, and of course, you know, absolutely following through and training your employees on all of that, and also that your programs are or your plans are up to date. And I will say one thing about Cal OSHA: they have an excellent a website that always has, and they pretty much update their model or draft injury and illness prevention plans. They did that with the COVID prevention plans as well, which now, as you probably know, can be part of your injury and illness prevention plan. So, you know, if you don't have one or you don't have the latest one, I suggest that you go online, look up, you know, Cal OSHA's website, go to those specific forms, and they have model forms that you can take a look at to then obviously conform to what your particular community is doing, but at least there you have a baseline of know what has to be included.
We're going to pause here for just a moment. We have another question that we'd like for you to answer. Okay, move on. Thank you.
Okay, I think this might, are we waiting for that answer, or we're just moving forward while you're tabulating?
Yeah, we'll go ahead and move on.
Okay, maybe Jeff or Glenn want to take this away?
Sure. So just briefly discussing requirements and best practices for providers when we're talking about pharmaceutical waste. Number one, development of policies and procedures. We always need to be able to go back to our policies and procedures, have solid policies and procedures in place that do meet all the regulatory requirements. And then, you know, that dovetails immediately into employee training and education. Critically important that we're obviously training our team members appropriately on how on this topic or on associated topics, and then how to specifically for this topic, how to handle pharmaceutical waste. Upon hire, so obviously if somebody, if we're hiring a med tech or a nurse, obviously upon hire, as part of their new hire orientation, we quickly need to be training them up on that topic, in this case, pharmaceutical waste. And then on an ongoing annual basis, then we need to make sure we're following up with them and have them sign off as well on these topics. Use of proper PPE. I know we've been talking a lot about OSHA and referencing OSHA and Cal OSHA a lot, but PPE, being that we're a high hazard industry, is critically important. So making sure that not only are we providing proper PPE to employees, but we're also doing our best to ensure employees are using the proper PPE. And both of those are critical parts of the training. It's our responsibility as an employer to provide the PPE. Yes, it's the employer's responsibility to use it, but we need to train them on how to properly use the PPE to protect themselves. Proper separation of waste in PPE, and we're going to talk more about this in a couple of slides. White versus black, specifically on the disposal bins for medications. Labeling. So again, medication labels should have a distinguishable identifier of for hazardous medications. And we previously talked about the pictograms that were there that showed some of the hazards associated with those drugs. Jeff and Diane both mentioned the drug acknowledgement example that was given, and then an assessment of risk. that Jeff mentioned also that allows deviation from the suggested handling of USP, the USP 800 standard.
Hey, Glenn, let me just chime in real quick on one thing. One thing I wanted to mention during all of this was the fact that when you have this program where it's handling, it's getting rid of it, it's receiving it, it really behooves the resident or the facility to have a designated person, that's responsible for implementing and maintaining the policies and procedures, for overseeing the facility compliance, for ensuring that, not necessarily doing the training, but keeping records of the training and ensuring that the environmental controls, the storage and administration areas are all in place. If you don't have a champion of this, a designated person, makes it really difficult to, just have everybody taking part, but yet making sure everything's done.
And Jeff, one other thought on this, I have a note here. It's not on the slide, but a note regarding best practices regarding the storage of these areas. I think most facilities are doing this, but it's critically important to make sure that the rooms or locations where you're storing these hazardous medication bins that we'll talk about in a moment, or other biohazardous type of equipment, that it's locked and it's not accessible to all staff. It's accessible to a small number of staff. So whether you're controlling access to that room via physical key, or whether you have a more sophisticated access control system to be able to give people access that only need access into that room, that's critically important as an engineering control. We've heard that term a couple of times, an engineering control, to make sure that only the proper people are coming into contact with these potentially hazardous medications.
Yeah, that's a great point, Glenn. And the only thing to put on that as well is that if it's a substance that's toxic and it comes in a special container, whether it's a liquid and it's in a special bag, it's really important to store it and keep it in those containers and those bags so that it doesn't leak out and cause any kind of issue with any medications next to it.
So this may be what everybody has kind of come for, and kind of how do we differentiate and what do we do and where do we put medicines? And I think I have these bins in my facility, and what do I put in them? And this is the part I think most people are most interested in. We're going to cover this in a lot more detail in part 2 with the nuts and bolts and the nuances. But today the purpose is to cover these type of bins and containers more in a more of a general format. One thing I wanted to address before we go on is there's actually a question, and I think it's relevant, and I'll address it now because it goes into this. And the question is pharmaceutical waste governed by the Medical Waste Management Act? Isn't medical waste broader than pharmaceutical waste? And the question probably came up because we're kind of talking about both. We've talked about pharmaceutical waste, and we're continuing to do that, but also now we're also talking about general other hazardous waste. Yes, they are different. Yes, there is a specific standard for pharmaceutical waste, and then there's a specific standard also for other medical waste, things that may go into biohazard bags, how to transport biohazard bags, and those type of things. So yes, they are clearly two different things, but many times there's bleed over with the two when it comes to just general best practices and how we're gonna deal with them. So most commonly, I'm actually going to start from the bottom up, not to confuse anybody. But we're going to start from the bottom up, and most commonly, we're very familiar with the red container, where we're normally going to, or sharps containers, right? Where we're normally going to put sharps. It's really important to make sure that in those sharps containers, we're putting just that, sharps, empty needles, right? Needles that are empty, whether there's engineering controls on the needles to where the needle self-retracts, that still needs to go in the sharps container. Many times, companies may have policies that if there's broken glass or anything like that, it obviously poses a puncture or cut risk, so it needs to go in a red sharps container. So truly, all that should be going in here are sharps and not other drugs. And those needles or syringes, when they go in there, they need to be empty when they go in the red sharps containers, because they're disposed of a little bit differently than other pharmaceutical waste containers. Then moving up to the white container with the blue lid. Some people call it a purple lid, just depending on your vision and what you see. That's gonna contain our non-hazardous pharmacy waste. No needles are gonna go in here. Again, needles need to go into the sharps containers, but non-hazardous pharmacy waste. And we'll be providing a short list of what are considered non-hazardous, some common non-hazardous in the RCFE type of environment. These will be what we call the U listed. We earlier talked about P listed versus U listed. It's the U listed things that will go in here in these containers. And in these containers, and we'll dive deeper into this in part 2. So we hope you join us next week on the 20th for part 2. We'll talk about there's actually a liquid that you put in the white and blue container for those U listed drugs that dissolve those drugs down, so they're no longer in pill format or other format. They dissolve those drugs. And then the black container is the one that I'm finding most commonly that facilities do not have, and that's going to be for the P listed and those that are acutely toxic to employees. And in the black container, you may things like OxyContin, Coumadin, epinephrine, warfarin, nitroglycerin tabs are examples, or inhalers are examples of things that would go in the black container. Again, those are some examples of P-listed drugs that may be commonly found in an RCFE environment. Lucky for us, we're not having to deal with chemo or trace chemo or things like that. So that's good for us. We don't even have to talk about the yellow containers. We can just simply focus on the black container, which are for P-listed, acutely toxic drugs. Again, I gave examples of the short list of those. The white container with the blue or purple lid, the non-hazardous U-listed drugs, no needles go in there. And then again, the red container or the sharps container, again, those are for empty needles, syringes, and things alike that can cut or puncture somebody. That's what's going to go in the red sharps containers. Before we get into questions, I wanted to give, and I know we're getting short on time, but I wanted to just give briefly a little information about Cal OSHA, having recently dealt with the 2-year Cal OSHA investigation that led to a trial. And really the best advice I can give you is this: Cal OSHA inevitably at some point is going to come in your facility, whether it's for a complaint visit or whether it's because we're a high hazard industry and they're coming in for a routine visit. Either one, it doesn't really matter. We need to be prepared. And Diane talked about it earlier, what elements you need to have in place, and she mentioned the IIPP, or Injury, Illness, and Prevention Program, or I2P2, whatever you want to call it. But at the end of the day, when they come in, here's the best advice I can give you. They're going to do an opening conference. We're going to listen to what they're there for, what they want to see. We're going to take them on a community tour. You're not going to divulge any more information than what they asked for. That's key. And that was a key takeaway from an inspection we recently had that ended up in trial, is a community decided OSHA gave the community a document request form saying, hey, we need all these documents. The community felt they were under pressure at that time to provide all those documents at that very moment, and they didn't take the time to review those documents to make sure they were proper documents, so on and so forth. So that's what got the community in trouble. So at the end of the day, there's really 3 main things that we're required to provide to OSHA at the day of visit. That's the OSHA 300 log, for the preceding 5 years, OSHA 300 A log for the preceding 5 years to include the current year, and then your IIPP. Those are the 3 elements that are required. All the other 15 or 20 documents or whatever it is that they may ask for, they'll give you a timeline and an email of where you can email those documents. So I just wanted to bring that up as a real world example, because we keep talking about OSHA and it's a big scary thing. But if you take what the example what we just gave you, it will help with that OSHA inspection.
Yeah, if I could just jump quickly in on that note and emphasize how important that is in terms of when they come in, yes, cooperate, say they hand you that thing, say, look, be happy to cooperate. Let me just let our consultant, our counsel take a real quick look at this. We'll get back to and give them, of course, what they're entitled to initially, because I've been in the same situation where I come in after, here was their document request, here's what we've already turned over to them. And there may be things that you obviously don't need to turn over to them. So always a good idea at the ground level to get help with those, so that you don't wind up digging yourself out of a hole for the rest of the time.
We have a couple of resources, and I want to mention, because there was the question that Glenn answered about the difference between the Medical Waste Act and what deals with the hazardous pharmaceutical waste. We have a legal library update on our website. It's the last one, the last bullet point. And it started with the General Medical Waste Act, and then we added to it in May to help you understand that pharmaceutical hazardous waste component of it. And the attorney from Hanson Bridget, who helped draft that additional portion, is going to be speaking on our panel next week, talking about the disposal of the hazardous waste. So I had a couple questions. When we were talking about the certain types of medications, Glenn went through a short list, and maybe some of you recognize some of those medications as ones that you have in your community. And if you do, you're going to want to make sure that you learn about the compliance aspect of this. But what would be the easiest way for someone to identify those medications? Is it coming from the pharmacy? If they're centrally storing them, it will have some kind of a hazardous label. Do they have to figure it out themselves, or how should employees handle that?
So there's a couple ways. Now I know our pharmacy puts on the labels hazardous, and it will put a 1, 2, 3, depending on what list it's on, that kind of thing. The other way is that some of the electronic medical records that these different facilities use do have a flag for hazardous materials that they can put on there. So when the med pass is going on, they can look at that and know how to handle it. And then, unfortunately, the third way is just really looking at those lists of all these medications and kind of identifying what medications you have at your disposal. So again, most medications are not going to fall on these lists. So a lot of the medications that your typical assisted living facility type of resident are not going to be in here. But then there's some surprising things, nicotines and things like that are common that are on the, say, the EPA list. So really just becoming familiar with those and kind of cross-referencing what drugs are coming in is the foolproof method.
And if I could just add one thing, Jeff, and you're absolutely correct, that would be in a lot of the facilities that I'm going in and out of and helping to support, we literally just go on a computer and type up the most common type of drugs that we may find in our facilities that our residents are on. Obviously, that list can grow or change, and type them out and literally paste it on the black bin, right? Not covering any important labels on a black bin, but put it on the black bin. And maybe an example, if you know that you commonly have Coumadin, warfarin, and nitro that you use in your RCFE facility, then go ahead and type that out and put it on the bin. Conversely, on the white bin, if you have other drugs that you know that are more non-hazardous and commonly used in your facility, an example, let's say Tylenol, let's just say Tylenol as an example, that's non-hazardous. It will go in that white bin. Maybe put that as an example. So that's one way to achieve compliance. Another way to achieve compliance within employee education when it comes to teaching our nurses and med techs and others that are dealing with this, what medications go in which bin.
That's a great suggestion.
Yeah, I like those best practices. And I had heard someone before, so correct me if I'm wrong, and we might go into this a little more next week, but what would be your suggestion of when in doubt, put it in the black bin? Is that a good way to go about it, or would you not recommend that?
I mean, you definitely have to be careful just because, and not to scare anybody, because this is a scary topic, but not to scare anybody. There are certain drugs that do react with others. And that's why the EPA and NIOSH have developed these lists, and many times they can be super comprehensive. So I would really recommend you reference those lists, you kind of highlight the most common ones that we see in our industry. Luckily, we're talking about the RCFE side of things, the assisted living side of things. So that list should be much shorter than what we'd see maybe in a skilled environment. So highlight those, become familiar with those, research those a little bit, and use those, as training aids for your staff. But definitely, if you're not sure, be careful which bin you throw it in. A good rule of thumb, though, is if it's a general OTC medication, over-the-counter medication, the likelihood is it can go in the white bin, right? Because that's a general consumable medication that I can go buy at the pharmacy versus a prescription medication, whether it's in a pill format or a liquid format or whatever it is, that may be more dangerous. We definitely want to be more careful with those in determining if it's going to go in the black bin versus the white bin.
Okay, that's good to know.
Hey, Selena, looks like we have some questions in the
Yeah.
Q&A.
So real quickly, just want to mention that this is being recorded. We'll send an email out to everyone attending so you have access to the slides. And then we will also make it available on our website for everyone, all of our members afterwards. Okay, I'm not sure Jen or Jeff or Glenn, which of you want to answer this, but could you please share insight on compliance when using RX Destroyer for pharmaceutical waste?
Yeah, I can chime in on what I've had experience with. And the first thing is that RX Destroyer will tell you you can throw it in the garbage. And you absolutely cannot do that in California. There are some states that you were able to do that. And even those laws are getting more stringent. But in California, nothing like that can go in the waste, in the garbage. And so if you're going to use that and you're going to put any drugs that are toxic in that container, that should be thrown into the black waste bin to go with everything else to be destroyed. That's going to be a tricky one because what is in it, and do you have a log of what's in it? So if Cal OSHA comes in and says, "Hey, what do you have in this RX Destroyer?" Do you have this list of medications that you put in there? Probably not. So you have to assume, well, there could be some Coumadin in there. There could be, any number of these other things. So the best practices, and getting back to what Glenn said, if they come in and you don't have a red, white, and black bin, boom, you're done in right there. So you're going to need that black bin, and that RX Destroyer can go right in it.
And next week on the 20th, we'll be diving deeper into that as well and giving real world examples of how to actually manage the waste. We'll be dealing more with that. The EPA requirements. I would assume that most communities, if not all communities, already have an EPA registration number for pharmaceutical waste. But if you don't, how to get that. So we'll be getting into more of the nuts and bolts and the mechanics of how we're actually going to deal with this farm waste in our med rooms and manage it to be in compliance.
We have about a minute left. I don't know if anyone of you want to add anything else, some closing thoughts.
I'll go first, and I think it's just, I know it's a big, scary topic, Nobody knows everything about this. There's a lot of resources out there. So I would definitely focus on a lot of the resources that are out there, whether it be the CALA website or, Google is our friend, to be able to get out there and Google pharmaceutical waste, best practices, and see what other industry partners are doing and other providers are doing, I think is one of the best things. But really, don't try not to be too overwhelmed with it. Keep it simple. Stupid is the method that I would use, the KISS method that we use with employee training. Again, training resources such as pictorials are great in our med rooms and other locations, and using those as training resources. And then keeping that short list of common medications that you may see or encounter clearly affixed to the container, I think is another great resource to kind of help narrow this very broad topic down.
Yeah. And I just say, with the one thing that they always look for when they come in is, do you have a policy and procedure, and are you following it?
Yep.
And so,
Yeah.
sure everybody's on board.
Well, thank you to our speakers and attendees. Oh, wait, there's one last question. What is the appropriate way to dispose of inhalers?
Want to take that? Or you want me to take that?
Go ahead, Glenn.
General rule of thumb is inhalers, without getting into all the different inhalers that are out there, inhalers typically are going to fall into P-listed medications, and they're going to go into the black bin. In general terms, that's where they're going to go. Next week, we will again be diving deeper into that, and obviously you can now see why we had to split this up into 2 webinars, because we'd be here for 2+ hours trying to talk about the employee safety and the compliance side of things. So we had to break it up. So I know I've said that a few times, but definitely next week, part 2, we'll dive deeper into the mechanics of how we're going to achieve compliance and which things go in which bins and how to use RX Destroyer and obtain EPA numbers and all those type of things.
Thank you again. And we will again send out the slides to probably sometime later today. And we hope you will join us for part 2 next Wednesday at 10 a.m.
Thank you.
All right.
All
Yeah,
right.
thank you.
Thank you, everybody.